By Maria CHENG and Laurie HINNANT, Associated Press London. An ambitious humanitarian project to deliver coronavirus vaccines to the world's poorest people is facing potential shortages of money, cargo planes, refrigeration and vaccines themselves, and is running into skepticism even from some of those it's intended to help most. In one of the biggest obstacles, rich countries have locked up most of the world's potential vaccine supply through 2021, and the US and others have refused to join the project, called Covax. The supply of vaccines is not going to be there in the near term, and the money also isn't there, warned Rohit Malpani, a public health consultant who previously worked for Doctors Without Borders. Covax was conceived as a way of giving countries access to coronavirus vaccines regardless of their wealth. It is being led by the World Health Organization, a UN agency, Gavi, a public-private alliance, funded in part by the Bill and Melinda Gates Foundation, that buys immunizations for 60% of the world's children, and the Coalition for Epidemic Preparedness Innovations, or CEPI, another Gates-supported public-private collaboration. Covax's aim is to buy 2 billion doses by the end of 2021, though it isn't yet clear whether the successful vaccine will require 1 dose or 2 for the world's 7.8 billion people. Countries taking part in the project can either buy vaccines from Covax or get them for free, if needed. One early problem that has emerged: some of the world's wealthiest nations have negotiated their own deals directly with drug companies, meaning they don't need to participate in the endeavor at all. China, France, Germany, Russia and the EU don't intend to join. And so many rich countries bought vaccines from manufacturers, before the shots have even been approved, that they have already snapped up the majority of the vaccine supply for 2021. As a continent of 1.2 billion people, we still have concerns, Africa Centers for Disease Control and Prevention Director John Nkengasong said Thursday. He praised Covax for the solidarity it represents but said there are serious questions about allocation, saying African nations' envoys are meeting directly with vaccine manufacturers to ask, if we came to the table with money, how would we get enough vaccines to cover the gap? The European Union has contributed €400 million $469 million to support Covax, but the 27-country bloc won't use Covax to buy vaccines, in what some see as a vote of no confidence in the project's ability to deliver. Instead, the EU has signed its own deals to buy more than 1 billion doses, depriving Covax of the bulk negotiating power of buying shots for the continent. Gavi, WHO and CEPI announced in September that countries representing 2/3 of the world's population had joined Covax, but they acknowledged they still need about $400 million more from governments or other sources.